Hi, everyone. Hi, guys. I legitimately could not figure out how to sign into my own live. So that was exciting. I was like, where do I even click? So that's good and fairly normal for myself. Hope you guys are having a good evening. So I had people write down questions in the live chat of like, if you can't make it, like write your name in here. And now I'm realizing like I had seen some earlier and now they're gone. So I thought they would stay there forever. So it appears that they have not. So that's a terrible method and we won't use it going forward. But hey, everyone, let me know how you're doing tonight. Hope you're doing well. We had quite, I feel like every time I come on here, I'm like, we had quite the evening tonight, and we had quite the evening. Let me just write a quick message on here. Let's see. Hey, everyone. Thanks for coming. Have any questions, leave them here. So we don't really have a topic tonight. If you're new and just stumbling on this, I'm Liz. I'm a family nurse practitioner, and every other week I just do these lives where you guys can ask, like we can just chat and hang out, and yeah, that's essentially it. So if you have any questions or anything you want to talk about, oh guys, just let me know. We are having, this has been, Avery got a new, at the person that she goes to for like daycare, there is a new other little girl there, which is really, really good for socialization. I'm actually really, really happy. But Avery no longer naps ever at daycare. And you can imagine, Avery does really well when she naps. So in our house, we're like, oh, hey, this is great. Also, we're having to start the Z-Pack conversation at work again. Lots of people are coming in, they're like, I need a Z-Pack. I'm like, oh, we can't be going into this yet. We can't be in Z-Pack season yet. I am not prepared. Hi, everybody who's just joining. I don't know why I always sing that. I probably should not, but it's fine. All right, so I'm just going to start at the top. And if you guys have anything you want to talk about or chat about, we're just going to hang out probably for like 45-ish minutes. And then I'm going to go do some yoga, take some deep breaths. I just had some coffee and it should kick in probably in like 10 or 15 minutes. So if the energy level just goes like, boom, it's because the caffeine came through for me. All right. Grapes. Keith said, what were classes like to become a nurse practitioner? Was it a lot of writing and research? Yes. So my classes were not a lot of actual instruction. It was a lot of here, read this, and then come to a discussion board about it. And then the teachers got paid. So, I mean, that's like harsh, but it was a lot of writing and a lot of research and a lot of teaching yourself. I have a video that compares my nursing school experience to NP school. And that one, if you just search nursing school versus NP school, I think it should come up. But yeah, it was a lot of writing and research, and you know how much I love that. Hi, Victoria. Hi, Ashley. Victoria, would you be open to doing virtual shadowing? So we have a student like every semester, so I probably couldn't do shadowing just because we already have students. And I'm not sure how much, since we already have a student, it gets kind of hard when you have students already then to bring other people in to shadow, because that's just a lot on the patient's end. You know what I mean? Like that, it kind of feels like they're inundated. You know what I mean? It's like when you're in the hospital and then you see the med student and then the resident and then the attending and like the whole world is there. It kind of gets that vibe. So not right now, I don't think, just because we already have a student and that's just like, that's a lot. But sorry, I guess. I'm sorry. I wish I could. Sophia said, hi, Liz. How are Piper's birthday preparations going? Oh, gosh. So Piper's going to be 1 in like 2 weeks. And we have already had a party, like a little like party, just like AKA cake and opening presents with my family and then Joe's mom's. And I think all we're going to do for her, like, we're not going to have anything really, because 1, we don't really know anyone. We don't like have friends here that we would, when it's like COVID, so or no one's having like friends over, but 2, we don't have like people we would like have over to have friends, we just don't have people that we would like get together with. And we're not huge, like I don't do events, like it's just so much work. I'm not like, you know how some people are like really party planning people and they're really into that, like making it Pinterest worthy. I'm more like, I'm going to buy you a candle and like put it on your cake and like, we'll sing to you. And I guess we'll just spend the day doing her favorite things, which are a lot of things at home because the child has never been outside. She never goes anywhere because she's in the middle. I was sad. Like she was 6 months old, not even 6 months old when the pandemic and everything started. So she doesn't even know if she likes outdoor activities. Like she doesn't know if she likes the swings in the park and all of that. So to answer that question, they are not going crazily. I did order her presents today. So I'm all done there. So all I have to do is wrap them. And I guess I should actually plan for something that we're going to do that day. But I'm going to make her strawberry shortcake as her cake because she loves strawberries. So I guess that's my plan. Nothing else than that. Also, she's 1 and she'll never know. Nurse Nice said, I am having a hard time with clinical. I feel dumb. Are you in nursing school or NP school? Because, well, both I feel like just makes you NP school clinical can be set up in a way to actually make you learn. You just feel really dumb in the beginning. So I felt really dumb for like the first 500 hours of my NP school clinical. And I feel like the last 250 were where I really actually learned a lot and was very helpful because then I could implement things and it felt like it was really going. Nursing school, I felt dumb the entire time because I've talked about this before and I don't think nursing school clinicals are set up very well because they pair you with different nurses and it's so disjointed that the system itself isn't made to make you learn well because in order to learn well, you'd need to be paired with one person who would then know what you know and what you don't to like build on that knowledge. It's like having a different teacher every single day. That just doesn't make any sense. So if you feel dumb, I'm sorry. I promise you are so much smarter. Like how you're feeling doesn't reflect the real situation. Your first job will train you. And everyone else has felt like you because nursing school clinical is a joke. And if you're in NP school, just hang in there, get like 500 hours under your belt and you'll start to feel a lot better. Kelby said, I'm just starting nursing school and I tell myself almost every day you can do hard things. It's true. I have to tell myself that every single day of my life until every day. So you can't do hard things. I can do hard things. We can all do hard things. 3-year-olds, guys. 3-year-olds. We can all survive 3-year-olds. Krista said, so happy to finally catch one of your lives. I'm a huge fan of your videos, but I used to be unsure if nursing school is for me. But your videos have helped me to join a CNA training fall. Oh, thank you. That's so sweet. I appreciate that. Good luck. You'll do awesome. That'll be a great background to go into like nursing, all of that stuff. I get asked a lot if you, side tangent, have to be a CNA to be a nurse. And it's certainly, you don't have to be. I was never a CNA prior to being a nurse. I was a waitress. But it is certainly a wonderful way to get in. You get so much experience if you're helpful and just make yourself known as like a helper on the unit and a good, someone who's like a team player. Nurses will teach you a lot and you're going to learn so much and kind of even get a direction of like, hey, this is something I definitely want to do or definitely don't want to do, or this is the type of floor I would never want to work on, or like, oh my gosh, I really want to work here. And that can be a great door into a job. Smiley Jason, I'm great. How are you? Fellow MP, mom working in retail clinic. Oh, thanks. I'm okay. I have the vlog that's going to come up on Saturday. Will explain a lot of like how I'm feeling, but I'm starting to feel better. It's been a really weird and rough like couple of weeks, but I think hopefully things are like moving in the right direction. And things will get better. It will all get better and be okay. Do you like working in a retail clinic? I'm curious because I've heard good things and bad things, but mostly I think good things. Kyla said, how are you? Everyone, thanks for asking how I am. Do you have any tips for my interview with the hiring manager for my first nursing job on Monday? So I have a video when you're done here. I have a video all about like questions I wish I would have asked in my first nursing job interview. I think it's called like either red flag or like questions to ask in a nursing interview. Definitely watch that. I don't remember what they are, but my past self knew and she put them in a video. Just the biggest thing would be to get a vibe for the unit and ask and look around and see what the other, I guess this is post-interview or pre-interview, but see how the other nurses are. If everyone looks like they're about to sob and looks like they want to murder people, it's not probably maybe the unit that you want to be on. Maybe it's a bad day, but more than likely, like that's probably not the area that you maybe want to be in. And the biggest thing for your first nursing job is you want a supportive environment, whether it's your first NP job or your first nursing job or your first CNA job. your environment is what is going to either make you want to run away from the profession entirely or be like, oh, okay, like this is challenging, because nothing's going to make it not challenging, but you could be supported in that challenge, or you could just be like beat down and be like, I'm gone. So one, like assess that. I would ask about what like the patient ratios are, how long the people stay on the unit is a good question of what their turnover looks like. And then just kind of like what other, I'm trying to think of what else I put in that video, but those are like big ones. I've found that, how often do people leave, and how many patients do you have? Do you have different things like IV teams? Like, what are the resources for you as a nurse? Are there like, are there CNAs? Are there techs? Like, what's the ratio there? And what type of things on the unit do they have to support new grads? So do they have mentorship programs? Do they have different like new grad groups where you meet together? Things like that. Let's see. Only day 4. Oh, if you're feeling like you don't know anything on day 4, Nurse Nice, you're fine. I didn't know anything on like day 90. So you are totally fine. Let's see, Grand Rapids, Michigan. Oh, that's so fun. I went there once, twice, actually met a few times. And every time there was a lot of really good breweries in Grand Rapids. Random question, it's actually young, but are nursing students allowed to start back to clinical yet? That totally depends on the hospital or the place that you are doing your clinical. Some places seem to allow students in and some people don't. I would assume it just depends on like how much COVID there is in the area and what kind of agreement they have with the hospital. Sarah Stapleton said, this is perfect time for me to procrastinate writing my fluid and electrolyte notes. I got you. Good luck. Alexander said, I had my first med surg yesterday and I'm already exhausted. Yeah, that's a lot. I thought it was interesting though. Like you're finally actually learning things that are, like why you got into this whole thing. Like you're already there. Beth Audette said, does anyone else have a black screen? Oh, I don't know. Does anyone else have a black screen? That's not good. If you do, I'm sorry. Zan said, I graduate in May. When would you suggest starting to apply at larger research hospitals? I graduate in May. Do it like a month or so before. So most of them are probably going to want you to have your, this is for like nursing and NP jobs. You can apply a little bit earlier. I didn't apply to any jobs until I had already graduated because I was really overwhelmed just with like taking the NCLEX, and then with my NP thing, like looking for boards. And I am like, I'm not the best student. So like, I didn't have any extra, and I was working, so I didn't have any extra like bandwidth to apply to jobs during school. So I didn't even apply to jobs until after I had passed my NCLEX and after I had already passed my boards. So I guess if you're being really proactive, you could apply to jobs. I would say no sooner than 2 months before, because jobs are really hoping, maybe even 6 weeks, because jobs are really hoping to kind of fill that vacancy probably within the next 2 months. And most won't let you get started until you've passed your NCLEX or your boards. Shakura said, how do you feel about nurse to patient ratios? What do you think is the best ratio for nursing success? That's going to totally vary on your unit. I think I was really lucky that the hospital that I worked on was pretty good at patient ratios. I worked on a med surg floor and our ratios were usually 4 to 5. Now that could get really bad if you had, a lot of times we were understaffed in terms of they pulled our CNAs to be sitters, and you could have 5 total care patients, and that was totally unmanageable. But hopefully, like, it wasn't always like that, but there were definitely like a good chunk of nights where it was like that. And I mean, that's just like impossible, and everyone's not going to get the best care that way. But when I worked in peds, for whatever reason, like, I don't know if the peds hospital had more money to hire more nurses. That's honestly what it seemed like, because our ratios there were more like 4 or 3 if the kids were sicker, or 2 if they were in the intermediate care unit that was on our floor. And that was very manageable. Like on the peds unit, I felt very safe. And like my ratios were always good, unless you had like 4 babies with no parents. They were just like screaming poor things all night. But I think a lot of I was really, really lucky in the ratios that I had. And most hospitals don't have those ratios. Like I've heard of people having like 6, 7, 8 patients. And unless you have a CNA or a tech with you, or like with you and one other nurse, like that's, and your patients are all really high acuity, that's impossible. Now, if you work at a really low acuity unit, then, and you're not doing drip, like on my floor, we did like drips. We had drips going, we could do up to BiPAP. So like the patients were they could be quite ill. But if you work on a super low acuity unit, like maybe you're not doing that. So it totally depends on the situation. But I think it's absolutely ridiculous that a lot of the times you are totally taken advantage of in terms of ratio, and there's no way to provide safe care. Great. Keith said, when you were working towards becoming a nurse practitioner, was it a lot of research papers? Yes, it was. I think we talked about that a little in the beginning. There were a ridiculous number of papers. Hi, Livy. Raiku said, hello, I'm very much new to this. I started school excited and scared. Oh, good for you. That's exciting. The beginning is always, I've gotten a lot of messages lately about the beginning being super duper overwhelming and like everyone's starting and being scared. And I will say the beginning is the hardest because they're just throwing so much at you. You know what I mean? Like your whole syllabus is laid out and you're like, oh my gosh, I have to write 6 papers and read this entire textbook that's this fat. And there's all these tests and there's so many assignments and discussion boards, and you can't do any of it yet because it's the beginning. So like, it's just like standing at the base of the mountain and looking up and being like, oh my gosh. When like, if you break it up into tiny bite-sized doable chunks every day, like you're going to be able to climb that mountain like step by step. But standing at the bottom, I dreaded the first week. I was also excited because you got like a new planner and everything and all your pens and you're like, oh, I get to organize. But immediately after that was like the dread. So just like give yourself some grace this week and next week as you like settle down into it, because it's going to be tackleable. It just doesn't seem like it right now. And pretty soon you'll be at the end of the semester and you're like, wow, I did like a lot of things. So you can do it. Try not to look at the whole picture of it, just like what you need to do today. And that'll make it seem a little bit more manageable. Hi, Lucas. Bianca said, who did you use for your letters of recommendation for your nursing school application? So I did not need a letter of recommendation for my nursing school application because I went to the school that I was an undergrad at, and I was considered like in, I think if you hadn't had any like demerits or something, then I don't know how you get a demerit, but if you had, all you needed was like the GPA, since they were accepting me from the same school that I went to. But for my nurse NP school application, you had to have, which I thought was kind of hard, you had to have a letter of recommendation from your supervisor at your nursing job, which then obviously told them that you were leaving. And that can cause a lot of difficulty. Like I got a lot of attitude from my supervisor when I then went to them and said, I need a letter of recommendation for this. And I know that's very, very, very common, even more so amongst CRNA students, because that means they will be leaving. When I went, I was like, look, I'm going to be leaving in 4 years. You know what I mean? But I ended up leaving the unit shortly after that anyway, for totally different reasons. But I've heard of getting a lot of flack, but I got one from there. So you could get it from your employer if you have one now, in terms of like nursing school. And then I got one, you had to have a letter from someone who was in a graduate level nursing, like who had a graduate degree in nursing. So I got one from someone else that I worked with on the unit who was like an educator. She had her MSN in education, she was not currently, I think, using it, but that's what I got mine for. So anyone you could get them from in terms of nursing, like any teacher. Have you had a teacher in the past that was really instrumental, like anyone from your prereqs who you kind of like got to know a little bit well, any manager you have ever had? Have you volunteered for a club? And like like if you were in high school, like the leader of, how like the faculty in high school, like they'll be associated with the club, someone in something who has seen you in some kind of like a leadership or responsible role. That would be a great person. But it is kind of hard. I hated asking. And give the people, when you're asking for letters of recommendation, like plenty of time. That's the other big thing. Victoria said, Club Med Shoe on Instagram is allowing hundreds of prospective nursing med students to virtually shadow healthcare professionals via Zoom. I'd love it if you joined and spoke about your experience. Oh, that's interesting. I've never even heard of that. Ellen S said, do you have any tips for physiology? I finished anatomy last semester and enjoyed it, but physiology feels so overwhelming already. I have a video on pathophysiology, which is like obviously not physiology, but I would attack it the same way of go by the objectives. So look in your syllabus, there should be most classes will offer like objectives under each module. So it'll be like the respiratory system or whatever. And it wants you to learn, these are the objectives. By the end of this, you should be able to understand how air travels between the bronchioles and the blah, blah, blah. And like pay attention to that. So when you're reading it, you're not reading all the fluff. You're like searching for the answers to those statements, pretend those statements are questions. And that's the easiest way to like work through the fluff and then make an outline of all your notes. At least this is how I did it. There's so many different ways to do it of those topics. I also loved Picmonic. If you go on that video, I have a 20% off code that I think still works, but you can also use one module of Picmonic a day, I think, for free. And I loved that for patho, and they might have a physiology one. So I would check, but that is how I bought that my year of NP school that I needed patho and pharm. And I loved that thing. It like makes questions for you, like little quizzes, and it puts things into like stories, which was really helpful. Libby said, can we rant about how much women's health is not taught about? And then you get older and you're like, what, that can happen? This is why health education is so important. Oh my gosh. Yes, we can. So I have gotten gradually more and more like passionate about women's health, which came out of nowhere because my past self would have been like, you hate, like, if you, like, that just would have been like an absolute nightmare. And when I started having to do like pap smears and all of that in clinical, I was like, this is just like the worst. And now like, I really like those appointments. So it's just funny. That's why I think like, it's just really interesting where your career might take you. So just go into everything with an open mind. But yes, if you don't follow, Mama Dr. Jones is a phenomenal person on YouTube who talks a lot about all sorts of like women's health things and answers a lot of those. Like, I think she's doing a really good job putting out there a lot of information, because you're right. No one teaches anyone anything. Health class was like useless and I just feel like so many women are just like, oh, well, this is normal. You know what I mean? And just because it's common doesn't mean it's normal. And I think there's not a lot of research that goes into women's health because and they're like half the population is obviously like has female reproductive organs. So it's just, it would be great if we could do more of that. Like a big thing of mine is like menopause now, because how many people experience symptoms of menopause, but there's like no research on it that like to help with the symptoms of that or anything. So yes, there we go. There's my tangent. I'm sure we can get more detailed in it later if you want, but that's my brief overview. Is some of you need to please go into research for women's health. My biggest thing lately, like I said, menopause. If we could go back to hormone replacement therapy a little bit, because that study that they did was kind of messed up and gave hormone replacement therapy a really, really bad name. So if some of you could go into that and like research that, and like we could just work on it and actually study the population that would be targeted in that, which is a lot younger than the people they actually studied, which is why a lot of the scary things happened. That'd be great. Okay. There's your DNP project for some of you. Thank you. I will probably be like menopausal by the time maybe we get around to studying that, and I will volunteer for it. Low Moon said, I feel my nursing school experience so far is just teaching myself so far. I know. If you've been around, you know, I am not a fan of nursing school. I think nursing education is ridiculous and a joke and should be burned to the ground, and we'll build it back up together in my world. When I rule the world, it's going to be a lot different. Nursing school is. Victoria, you're welcome. Beth said, oh, good. She was the one that was worried about the screen being black. I'm glad it is not black. Diana said, how do you deal with people who don't believe COVID is real? By the way, I love your energy. Zoloft. So I started taking that again. And that's what we'll talk a lot more about on like Saturday's vlog. But I can't hang. Like I was going from, I don't have a good way to deal with it. So I have started, it was giving me a lot of anxiety. Like I've never had anxiety in my life. We won't talk a ton about here because there's going to be like, I'm going to go on a whole film whole video about it because I don't think we talk about mental health enough. So we might as well make a whole video about it. But I cried every day going into work for like the last month because I was going from literally working through signing like death certificates from people who had like died at home of COVID or like from other things. And then, well, I can't sign them in North Carolina, but like filling them out. And then, or talking on the phone with a lot of patients whose family members had died from coronavirus, and then seeing all like, texting my friends who are working inpatient with it and they're getting exposed. Some of them have caught it, to then going into the next room and having the person swear at me because they don't think it's real and they're mad that they have to wear a mask in the office now, and, you know, calling me all sorts of names and saying this is a liberal hoax, and like the dichotomy of that every day, like, and where I live, especially, a lot of people think it doesn't exist. And I just can't handle it. Like, I have no good way of coping with it. I was like exercising every day and doing all the things to try. And I thought maybe I was doing okay. And I just wasn't. I'm really angry. I'm still really angry at a lot of people. And like, it's just really hard. It's hard. I think if you also live in an area where a lot of people just don't believe it's real, like it is really, and like, it's just hard. I've been going a lot and giving, like, every day I'm talking to a lot of crying family members because coronavirus is also like affecting anyone going into the hospital can't have family there. And so I can't imagine having a loved one in the hospital and not being able to have your family there. And we've had like in our own family lately, there's been some hospitalizations, and like, to not have family there because of coronavirus, and then just to have people say like, and then especially if they pass away, like to say it's not real. Like, I can't in my mind hold the two next to each other, and I try to be an understanding person. And I can't reckon those two, you know what I mean? Like, they don't sit well. So I don't have any tips there other than I'm angry and sad and right there along with you. If I find something out, I'll let you know. I've tried educating. I've tried being like, you're very like, my first approach was to be like, when people were like, oh, it's not real, I was like, oh, like, you're very fortunate that you have not had anyone that you love experience it. And that just didn't go over well. It didn't work. So my usual method when people just like are totally incredulous to something and don't believe anything is to like educate and try to understand where they're coming from. And with this, I just can't. Jade said, I'm taking my last 2 prereqs. That's so exciting. Math and science and anatomy and physiology. Any study advice? I'm so excited to finally be done with these prereqs. Just my usual stuff, like break it down to what you can do a little bit every day. Like, I really liked Picmonic especially for like those classes. And then, I mean, if you're in your last 2 prereqs, you probably already know what study strategies like really work for you. And then go for it. You can do it. I don't have any great advice there, other than just keep doing what you're doing. You're obviously doing a great job, and that's so exciting. Know that when you're done, use that motivation to like get you through it. Because prereqs, when you're done with prereqs, then you get into like the actual classes. I thought prereqs are really hard because I was like, I don't care about this. Grace said, I've heard that in 2025, the master's degree for advanced practice nurses will be changed to DNP. Is that true? Could you explain the difference between a DNP and a master's? So I can't explain the whole thing. I'll do like a really abbreviated version, but if you want like a good explanation, I have a whole video. If you just Google DNP versus master's, I also have a video about what do all the letters mean is what it's called. And it is talking about the difference between DNP, NP, and then your license or your certification. And that one might be helpful too. But they keep putting that date back. So I think everything is slowly transitioning to the DNP. Do I think we'll be totally DNP by 2025? No. When I was in nursing school in 10 years ago, everyone was like, oh, by 2015, the NP will be a DNP. And then it was 2020 and now it's 2025. So I don't think it'll be totally switched over. If it works in your life, like I do think eventually that will be the degree. I think people will be grandfathered in for quite a while if they have their MSN, whether or not they eventually make MSN, NPs, and APRNs get their DNP. I mean, who knows? I think if they do that, then they'll have to come out with a lot of really streamlined programs. Like now we have RN to BSN programs. If it works, if you want to just know that, okay, I'm done, and be done, and you have time and money to do the DNP, perfect. But if it really doesn't work with your life, like I didn't do the DNP because I knew that I wanted to have another baby and like live my life and enjoy the one that I did have. And I didn't want to spend any more time doing school. I wanted to like live a little bit of life, since having my DNP wouldn't change my practice whatsoever at this point. I decided to just like do my MSN, and then later, if I want to get my DNP, I can do a bridge program. That's kind of what I would look at it with for you is, do you want to just be done one, or do the programs in your area? A lot of programs that are in person, if you want to do an in-person or a hybrid program, a lot of them are turning into just DNP programs. So that could answer it for you. In-person programs, a lot of them will offer you finding a clinical. So that's golden. The program I actually did is now a DNP program. And that might have been what I ended up doing because I only wanted to go to a program that was going to find my clinical for me. And it had an in-person component because that was really important to me, that I have like hands-on learning. So, I mean, if honestly, like if I was looking back at it, like I probably would have been, even though it would have been another year and it would have been like sad to not have that time with the girls like Avery, like I probably would have done it because that was my only option. So it just kind of totally depends on what you're looking for. The only difference between a DNP and a master's in being an NP is you do, in most master's programs, you come up with a research project and you research it and you talk about how you implement it. And in a DNP program, you learn a lot deeper level of statistics and you actually implement the project and analyze like the data of it. At least that's the difference between most MSN and DNPs. You write a lot more papers. I honestly think the DNP is in most schools not utilized well. Like we could have done a lot cooler stuff with it rather than write a lot more papers and do discussion boards. That just kind of seems like some BS. Like, why are we wasting our time doing this when we could specialize or like do something cool with it? But that's just more of like how I feel about nursing school coming through. So there's that. Let's see. Emily Ram, I'm starting my first day of nursing school this week. Any advice? Oh, good. You got this. Just like, take it one day at a time. I think that would be my biggest advice, would just be take it one day at a time. Remember, you're at the bottom of the mountain and it's going to be like hard to look at all of it. And that first week's going to be overwhelming. And so just know that, like, don't go into it feeling, you're going to feel a little bit defeated after this first week, and there's nothing wrong with you. It's just the nature of the beast being at the bottom of the mountain. Let me see. I lost my place. There we go. Other people are saying that, yeah, they felt like it was really hard at first in the beginning of nursing school. Can you give us advice for studying for the NCLEX? I have a video on that of like what I would do. I would probably do UWorld if I did it now. When I took the NCLEX, guys, I like fortunately went to school before like social media was like how it is now. So like you didn't really hear, there was no like nursing influencers or people weren't sharing their nursing journeys. So I studied for like 4 days. And I was just like, I'm going to wing this. Like, I'm just going to kind of I read through a Saunders book and that was it. There were no question banks online because that just wasn't a thing. There was no like, but you weren't also like hyped up and you weren't seeing everyone else's study strategies and all these YouTube videos of like how to pass in 75. I was just like, everyone was just like, I'm just going to read this review book. Kaplan existed, but only the rich kids could do it. And I didn't fall in that category. So like, I was like, well, I'm going to go and read this Saunders book that I got, read through all the questions. And I read all the rationales of every single one, even the ones that I got right, so that I would really have a good grasp on it. And then I went to Borders and I read, there was like a different question bank that they had, and I didn't even buy it because I was so cheap. And I sat on the floor there and like read through some of those while Joe was working at Chili's on my night off. So don't be me. 4 days. Yeah, so I wouldn't do that. I would probably do UWorld, but you know, it was a different time. I mean, at the same time though, it was nice because there wasn't like stress of it. You know, I was just like, well, we're going to do this thing and it's either going to work or it's not. Anna said my nursing school had us with one preceptor per rotation. That is awesome. But you can't imagine being it any other way. It's also hard being a preceptor when you don't know what the student knows. Exactly. So that's, I think you're really, really lucky. That is not the norm, but that is so helpful. Like, why can't everywhere be like that? Let's see. Krista said, thank you. Can you talk about what it was like the first months out of nursing school? I have a video on the first 6 months. It's just rough. I cried a lot, like every day. I was on like a mostly supportive unit, but not totally. Like, it was just really high acuity and you didn't have a lot of help. The people were great though, but it's just a lot. Like, you are in charge of people's lives. And that was just like a huge adjustment. And you don't know anything. You don't even know what you necessarily don't know sometimes. I think the first 6 months of nursing were the hardest. They were harder than being a new NP. They were the hardest. It was hard. You can absolutely do it. I'm not saying that to like scare you, but just so that like, know that you will get through it. Most people like feel like that. And you will get through it. Just like ask a lot of questions, find a good support group amongst your peers so that you can like talk and bounce things off of each other, because feeling like you're not alone is huge. But you also might cry every day. Again, a little bit of Zoloft might be, I knew a lot, I laugh, but like I knew a lot of new nurses who like just for a couple months there, like needed a little something. And that's okay. That is an incredibly anxiety-provoking time of life. And it is okay to go to therapy, to really not do a lot else, like whatever you need to do to take care of yourself during those months, just do it and know that it does get better. You're learning so much in that first time. Like, you will be okay. Nothing is wrong with you because you feel a little bit overwhelmed, and like social media might try to tell you, like, social media is such a good thing, but it's also so hard because so many people paint this picture of like, oh, I popped out of nursing school and like everything's perfect and wonderful and like, look at me. And these are all my tips for like, if you do X, Y, and Z, like you too will have a seamless transition. And that's just not realistic. Like, everyone is going to have a different path. So never, ever, 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 I guess that's the other thing, is like compare yourself to, one, what you see on the internet, and two, what your friends from nursing school are going through, because one, they're probably not being honest with you. And two, they are in a totally different unit amongst totally different peers in a totally different situation. So you cannot compare. Do not compare what you know, what they know, what they're doing, who's on the bougiest unit. Cause like there's like, everyone likes to have a hierarchy and it's just some garbage, but don't compare. You're doing a great job. Hi. Mel said, I'm currently in nursing school and I'm so glad that in my school our teachers are nurses and the ones that precept us during clinical. What? Where do you live? I'm surprised that it's not that's how it is in the US. That is amazing. I mean, some of our teachers were nurses, but like didn't really practice. I'm definitely not on the unit we were on. Sala said, hi, Liz, I'm thinking of going into an online university like Drexel. What are your thoughts? For NP school or nursing school, I don't understand how online nursing school would work, but I just also don't know a lot about it. And I felt like nursing school was so hands-on. I'm like, how would that even work? But NP school, I think as long as I've said this before, like, do they find your preceptors? If they don't, that is really hard. So just go into that knowing, like, if you already know people and you're well connected, like, okay, that's not as much of an issue for you. But finding preceptors is incredibly challenging if you don't have connections. And two, do they at least have a week or two of online skills training? Because how are you going to learn how to do a pap smear, how to do a prostate exam, how to do a laceration repair in a lab if you're not, like, are you going to practice for the first time in clinical? That seems not safe. Like, you know what I mean? Like, so if you're going online, make sure you do have some in-person assessment, like lab, you know what I mean? Like, someone needs to watch you do a detailed physical assessment and then tell you, like, yes, you're doing this well. No, you're doing this well. Hey, move this a little bit to the left here. Move this to the little bit to the right here. Videotaping yourself, I just don't feel like is a good substitution of that, but I'm biased because I went to an in-person one where I found that very helpful. So take that with a grain of salt. Everyone's experience is not mine. But other than that, I think online programs, like, there's so many of them. There's a lot of good ones. So as long as they have those components, those are just my two things to watch out for. Jay said, I'm currently in NP school. My question is this: do you feel the NP market is super saturated? It seems like so many nurses are in NP school and so many NPs say they can't find employment. I think that totally depends on where you live. I think some areas it is very difficult to find a job. I've seen things saying that, like, everyone's always saying like, oh, there's like plenty of NP jobs, but a lot of the NP jobs aren't necessarily where you might want to live. You know what I mean? Like, yeah, are there NP jobs? Yeah, I'm pretty sure there's a lot of NP jobs in like rural Wyoming, you know what I mean, where they really desperately need healthcare providers. Are there a lot of NP jobs in Raleigh, North Carolina? Not quite as many. Are there, like, if you follow the Resume RX on Instagram, she talks a lot about like finding jobs that aren't posted online. And I think there's a lot like, I think that's a really good point. Like, there are just like reach out and market yourself, even if they're not necessarily like a job posting. So I think there's a lot of value in that, but I do think we are approaching, like, nursing school is trying to retain their income by re-enrolling their nursing students really quickly. So you're in nursing school and they immediately pitch NP school to you, and they're like, oh, you'll make more money, your schedule will be better, you know, X, Y, and Z. They're gaining what, like 50 grand, 30 grand from having you re-enroll really quick. And it's just turned into, like, I feel like a lot of the nursing profession has seen like NP school as the next step, which I think is a true shame, because there's so much you can do within nursing that doesn't involve going back to NP school. And I do think we're going to hit the point where there's just too many. And like, I think we're going to hit a point where there's going to be with all the online programs that are not, there's online programs that are good. And then there's ones that never have you show up in person, that are not heavily monitored, where they don't really teach you anything. It's just kind of like a diploma mill. I'm worried that that will make the credibility of the education a lot more, like, you know, iffy, and then people might move to PA, but that's just me being a worrywart, and I worry about things. But I do think in some areas, especially when you are a new grad, if we're being honest, I do think, so if you want to go for it though, I only say that to say, like, I would never say if you want to do it, if that is your passion and you're like, I absolutely want to do that, absolutely do it, because where, in this case, like, where there's a will, there's a way. You will eventually find a job. You can absolutely do it. But if you're kind of sitting there and you're like, well, like, maybe I'll do that. Maybe, like, if you're in the mindset of like, oh, that's just the next step, I would really reevaluate it, because that's not, like, there are so many other steps that, you know what I mean? Like, also, like, the NP job it's really hard. Like we talked about, like, just like emotionally, and like, if you're doing it to get away from like the hospital bureaucracy of like, that's not a good step to take, because there's so much bureaucracy and like hoops to jump through in NP land. But if it's what you really, really want to do, I guess that's what I'm trying to say, is like, if that's what you really, really want to do, absolutely go for it. Like, you will find a way to make it work. But if it just seems like, like, seemed like a good idea at the time type of thing, like, maybe reconsider. There are so many cool things you can do within nursing without even necessarily going back for more school. You know what I mean? Like, so if you're just tired of being at the bedside, or you're just tired, you want like a different thing, like, look into so many other, like, legal nurse consulting, like all sorts of being a case manager. Like, there's so many different things you can do if you're just like kind of over it and want to change of pace. That was a very long answer to a not long question. Natalie Jackson said, hi, Liz, any advice on working while in NP school? Currently in an oncology infusion nurse, but I'm considering working from home, but I'm unsure the type of work that would be required and how I could do that with 4 children. So the kiddos would probably have to be in daycare. You kind of have to treat school like NP school. So when I did NP school with Avery, like, I did all of my homework when she went to bed, and when she was napping, I had absolutely no life, and she was and then I was working. So she went to daycare like full time, and I was either working or in clinical. And I was just like, I worked every single weekend so that I had my week available for school days and for clinical. And then I had one day during the week where she went to daycare, and then I was home and could do homework. And you kind of just have to treat it like that as a job. Having set like I guess it would just depend on how much you're working, because your work schedule does have to be somewhat flexible to accommodate clinical, because most clinical is going to be during the week. Unless your clinic happens to have like weekend hours that you get do clinical at. But it's just, you can definitely work. Most people, I think everyone, except for like 1 or 2 people in my program worked. You don't have a lot of you time, but it's not forever. But utilizing daycare and other people helping you with children was essential. Like there's no way you can study if you're like watching children. You know what I mean? You just had to like commit to being like, all right, like we're going to do daycare, and it stinks. It's hard and you don't have a lot of time for you. But like I said, it's like a short term. It's not forever. It's just a season, but it's definitely challenging. I cut back. I worked full time while I was in school. So I worked full time and I was in school part-time. And then when I had Avery, I went part-time because I just couldn't, I couldn't squeeze everything into nap time and bedtime, and it was just not working. Livy said, thank you for the encouraging and real videos you make. I made the jump. I will hear back about nursing school applications in October and for a spring start. Fingers crossed for you. And then Lexi Mickey said, what are your thoughts on burnout during nursing school? I'm in my last semester, but I also work as a CNA in long-term care. Motivation is gone. Everyone gets burned out. School is grueling. I mean, it is years. You know what I mean? Years of working your butt off with no perceived return. You know what I mean? Like nurses get burned out and they're getting paid. So when you're in school, it's even worse because you're like, I'm doing all of this. I'm not getting paid. Like this is just the worst. And just going back to remembering why you got into it in the first place is really all I have to offer you. And remembering that if you drop out now, you're going to be stuck with the job that you had before. And there was a reason why you got into this. So that's what I would just tell myself was, self, one, you have a lot of debt from this, like $50,000 worth of debt, which you probably aren't going to pay off being a waitress, which is what you will become if you drop out of school at this point. And remember when once upon a time you wanted to like change lives and this seemed like a good idea, think back on that and motivate your butt right now. And that's kind of the pep talk I would give myself very frequently. And then I would go have a lot of coffee and some sugar and mope for a little while. And we moved on. It's also a lot easier because, as I said, in the Stone Ages, we didn't have Netflix or any streaming services to distract ourselves with. So it was easier. But that's how I always motivated myself in nursing and NP school. In NP school, it was more like, wow, like I've paid a lot of money now. And Joe would kill me if I quit now because our lives have been a little bit rough while I was in school and working full time. So that was a good motivation. I didn't want to get divorced. Brady said, finishing up my prereqs for nursing school, any tips for micro? Khan Academy had great microbiology classes, but other than that, no, because microbiology is the only maybe the only test that I have ever sobbed in. Not likely cried, but sobbed during the final. I got a 30-something%. Fortunately, it was curved so that I got a C. And all was well. So that made me feel better about crying. I wasn't the only one in tears, but I have no advice for micro because I did not do well. Queen Sarah, do you have to do your NCLEX right after your nursing program? I wouldn't wait because then you're just going to forget stuff. I did mine as soon as my ATT, like ticket to test processed. I picked the soonest date that I possibly could. And I drove quite a while to my test because everything within range was booked up. So I would do it and just get it over with. You do not want that hanging over your head. And if you're anything like me, you're going to forget it. It's I needed to take that as quick as I could. It's great too. Jesse said, it's great to see you again. I hope you're, thanks. Good to see you too. Veronica Kane said, hi, Ricky. Well, Veronica didn't say that. I'm saying that. I'm reading backwards. Veronica said, hi, I just have to say my husband and I love watching your videos. Oh, thanks. As well as stories on Instagram. We're both RNs and he's in NP school. He got his NP binder and we used your Peloton code. Oh, thanks, friend. I hope you love it. I love my Peloton. Queen Sarah, can you choose what department you want to work as a nursing student? it depends on your school. I got to request to be in pediatrics for like my preceptorship, and you could kind of request if you knew, like I knew I wanted to end up in peds. So I requested peds. It's like, I let my teachers know that. And they put me in peds whenever they could. So like my community clinical, my psych, maybe not my psych, my community, a couple of them. And then my preceptorship was in peds. So just let them know, and then they can kind of work with you, but you might not get what you want. Narisha said headed towards advanced pharmacology and an FMP program for Chamberlain. Any tips for getting through advanced pharm? I loved Picmonic saved my butt in pharm. I have a whole video on pharm though, and it has like a coupon code for that, but I bought Picmonic for pharm because I was so scared. It's like, and I did like a module a day. And then I realized like, I'll just buy it. But I think I have a code in that video for like 20% off, I think. But highly recommend that. And it like teaches you the drugs through stories, and that I used it for all my classes, but for pharm, it was like the thing that made me remember it. Also remembering roots of the, like the stem of the med was really important. Like a lot of them are either going to start or end the same way. And repetition and really like flashcards were really helpful for pharm. But I have a whole video on it that I made that when I remembered more of it, but those were like my big things. Let me see. Marcia said, hi Liz, I'm a new NP here. Any advice for when patients don't want to see you since you're the new provider? So one, just take it as a bonus time for you. If they don't want to see you, it's like, cool, charting time, catch up on labs, go through that enormous stack of paperwork in front of you. Do not take it personally. It's not personal if they don't know you. You know what I mean? Always treat it as bonus time. Like I said, never a bad thing. But if they come in and they're like, say they enter the room and they thought they were seeing someone else, or they find out you're like, they don't know you and they're like, oh, I don't want to see someone who's new. Be like, okay, no problem at all. You can reschedule with so-and-so. We can send you back up to the front, and like they can reschedule you for a different day. Or I'm happy to see you today is how I usually say that. Half the time they're like, I'm just going to reschedule. The other half of the time they're like, fine, I'll just see you. And by the end of the appointment, most of the time they have agreed to see me again, and we go on to have a lovely patient-provider relationship. But if they don't, if they say like, peace out, I don't want to see you, I'm like, peace out. I'm going to go have a snack and get caught up on my life. So don't take it personally. I actually quite enjoy it when people are like, I don't want to see you. I want to see Dr. So-and-so. I'm like, hi, excellent. I'm not sad about it. And over time, eventually people are going to be like, most of the time I've acquired, I don't have my own panel, but like there are people that see me more and people that see the woman I work with more. A lot of those people came in for an acute complaint. I was their only option, and now they like to see me for everything. You know what I mean? So just like be kind. Don't seem offended, and it'll all be fine. Alex said, did you have to do a service learning project when you were in nursing school? Yeah, but I don't remember. I don't remember what it was. It was something about, I don't even remember what it was, but yes, I did. Free and Breezy said, are you still in contact with your friends from nursing school? I chat with one or two of them. Yes, but not really anyone else. I kept in contact with them for the couple of years. So I graduated from nursing school like 9 years ago. And we were pretty good for like 5-ish years. And then a lot of them kind of fell after that. And then there's like one or two girls that I still talk to a lot, or a good amount. And then the girls that I go to NP school with. So that we graduated 2 years ago, and we still have like a group text that like every couple of months we'll kind of just like catch up with. So that's always nice. It's nice to have like your little peer group. Let's see. And how long have we been here? Okay, so I'm probably going to do a couple more questions and then wrap things up and go and do my yoga to try to like zen out from the day of people calling me a crazy person for believing coronavirus is real. Kristen said, do you know much about travel nursing? No, but lots of people on Instagram do. So I think Sarah Gaines on Instagram has like a whole course on travel nursing, but she's also a wonderful resource. I would go hit her up. Natalie PNP also does. I'm trying to think of like who I follow that does that. She did travel nursing, and she has a lot of posts on her Instagram about travel nursing, so that might be helpful. If any of you know of anyone else who does travel nursing, let everybody know, because I honestly don't follow a ton of YouTubers that are nurses, because I let YouTube tell me what I want to watch. So I watch a lot of really like flight attendant vlogs, weird like cooking shows where they cook things from like TV shows. What else do I watch? It's a very eclectic candy making, very New York City apartment tours. I just kind of like allow, and medical school vlogs I'm weirdly into. But I really don't watch a lot of nurses on YouTube, mostly just because I don't, obviously I watch Alyssa all day because, we're friends, but I don't watch a ton of them because I don't, I feel like we're in different lifetime. Like a lot of people on YouTube that are nurses are just like a lot younger than me. And I'm like, I can't relate to this life anymore, but there's a lot of great ones out there. And I'm really grateful for YouTube because I feel like it shows an awesome, diverse group. If everyone was a mom and had a boring life, like it would be really boring. But fortunately, most people have lives, and then there's just me over here. I'm like, I'm a mom and I have 2 kids and I'm covered in barf all the time. Welcome to my channel. Let's see. Desiree. Oh, you're from the Netherlands. That's exciting. Thanks for being here. It must be really late there. Someone knows there. Oh, PewDiePie, I feel you and know where you come from. We need to move soon. Yes, we live very close to each other. We've decided that if we actually lived close, we would be best friends because we agree on so many things. But yeah, I've never lived in the South. This is my first experience living in the South. And it is, there's lots of like, obviously nothing, it's just different, very, different than what I'm used to. A lot of people don't believe in coronavirus. And, yeah, where I live, like a lot of people, it's just different. No shade if you live in the South and love it. Stephanie B, do you have any tips for a mental health clinical? I'm going to be really real with you. Mental health clinical, in my experience, was not helpful. They kind of just put you in a room and then let these poor patients out and told you to therapeutically communicate with them. They didn't want to talk to you. They wanted to watch TV or like do whatever they were doing during their like free time. And then you awkwardly got put into small groups with them, like during their therapy sessions. That's uncomfortable. Like I felt like nursing school like when we went into the mental health hospital was just really invasive, unhelpful to the patients. And, like they didn't put us in a position to really gain anything from it. They were just like, here, exist in the space. Like, I think it would have been better to have us be more of, I don't know, facilitators in some kind of like dialogue, or to like participate in running a workshop, like, and giving us a little bit of training on like how to do that, versus just have you like, if I was a patient, I wouldn't want some students like just hanging out in the lounge or like in my small group where I'm obviously going through something, like just sitting there and listening. Like, I just feel like that's a huge invasion of privacy. So I don't have any tips other than like get through it. It's uncomfortable. Maybe your experience will be different than mine, but that was mine. And it was just, it felt very invasive and inappropriate, if we're being real. But you don't do anything. It's kind of like labor and delivery, where nothing is really required of you other than to absorb. Hopefully you're not going to be delivering babies on labor and delivery, but similarly, a lot of people message me and are really worried about like mother-baby clinical. You hold a leg, and that's really all you get to do. You might get to watch a C-section, but nothing is required of you. You know what I mean? So just get it through it and it'll be okay. Let me see. We'll do like 2 more questions, and then I'll probably head out and then we'll do another one of these in 2 weeks. I think that we'll just keep on that trend. Hopefully you guys like doing these lives. Thanks for hanging out with us. Me, I'm not 2 people. Yikes. The caffeine has hit. Menwa said, do you have, did you have any thoughts on doing a pediatric clinical, how it could be done online? My school's supposed to have clinicals at your old hospital, but they're only allowing their own students this semester. Ugh. I mean, I don't feel like it would be like, what's the point? You know what I mean? Like with online clinical for nursing school, like the whole point is like interacting with kids and learning how to talk with parents, and seeing like stuff with kids is just different. And seeing them, I mean, not to be bad, but like seeing them decompensate, because kids decompensate so much differently than adults. And you aren't going to get that through like an online clinical. You know what I mean? It's going to be the kid in front of you that's not doing well, or like how to, just do vitals and all of that stuff on tiny people, because it's very different. How to hold them down, how to do all of those things. You're not going to get that from online clinical, but what are you going to do? You know what I mean? Like if you get a job in peds, then they'll teach you there. That's kind of what I wouldn't stress it. Don't stress about it if you can't change it. You know what I mean? Own it when you go into interviews and just be like, hey, look, this was my experience. This is why I still want to go into this. Like, I'm a really good communicator, so I think I'll be doing that. Like, I'll fit that well. I am very adaptable. You know, I was able to go through school with all of these changes, and give the other parts of why you would be a really good asset for this team, to make up for the fact that, yeah, you didn't have clinical, but really in the scale of like clinical is such a short blip that does that really matter? No, you can always teach someone new skills. Lacking that clinical, probably not a big deal at the end of the day. Like we had talked about earlier too, like nursing clinical is often so disjointed that it's just like, who cares? Not who cares, but you know what I mean? You'll be able to make up for it. I wouldn't count that as like, oh, well, you didn't get to have clinical, now you can't have a job in peds. Joseph Yeb said, would you ever consider a teaching position? I would love to teach. I just don't want to go back for my doctorate, if we're being real. And yeah, so maybe one day. But I also, if you can't tell, really don't love the way nursing school teaches and the way it's structured. And so I feel like that wouldn't mesh well with like, obviously it's kind of hard because like you need different people to get into the nursing education system to change it, because I think it needs a lot of change. But how do you fit those? Like those people aren't going to get hired. Like I feel like no one would hire me when they're like, hey, what do you think of this? And I'd be like, I think we should burn it down to the ground and like build it back up. And like, here's all my ideas. And I feel like they'd be like, no. And then I'd be like, well, never mind. So I don't know, maybe when I'm a little bit older and more mature, I would love to. So I'm just waiting to like get a little bit less opinionated, maybe a little bit less spicy. And we'll see how things go. I'm going to try to get a job somewhere where my girls want to go to college. I'm going to force them to go to the same college where I'm a teacher. That's the long-term plan, so their tuition is paid for. So I have 13 years. So 13 years to mellow out a little bit. Send me good thoughts. All right, guys. Deanna, congratulations on passing your NCLEX. That's so exciting. All right, there are more, but guys, I don't have any time and I'm so sorry. I'm going to do these every other week, or I still do them every other week. So if I didn't get to your question, I apologize. Thanks for being here. I wish I could get to everyone, but I just need to go have a moment and then do all my dishes. And then Joe and I are going to continue watching The Office, because that's our just like happy bonding time while I cross stitch. And that's my evening. So thanks for being here, guys. I will see you in normal videos coming up, but we'll see you here again in like another 2 weeks for another live. And yeah, thanks for hanging out, guys. Have a good evening. Good luck with everything. Bite-sized pieces. You're at the bottom of the mountain, looking up. You can do hard things. I think that's all. Bye, guys.